My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. For the last 25 years, we have been researching on all illnesses, mental and physical, and we have been able to cure more than 100 diseases without medicines. Now, the definition of mental illness has changed over the period. Earlier, only people who are totally disturbed in their life and roaming around directionlessly were called mental patients. Now, the new definition is anybody who has got more than necessary fear, more than necessary anger, more than necessary sadness, more than necessary worry, more than necessary seriousness, all are in the category of mental illness. More than necessary stress, more than necessary tension, who are suffering from sleeplessness, these are the new definition for mental illness. Now, how do we find out whether the disease is mental illness or physical ailment? The best parameter is within 10 days of taking medicines, if there is no improvement, then it is called mental illness. So in this category, migraine, cancer, arthritis, blood pressure, diabetes, they all come in the category of mental illness only, because stress is the main reason for mental illness. We have developed a scientific test which the patient himself gives. We have named it as mind mapping, and within 15 to 20 minutes the results are out as to the root causes of this illness. Today we'll be talking on kidney complications, kidney failures, kidney stone. A human being are given 2 kidneys, but 1 kidney is sufficient for the lifetime. Now let's understand the role of kidney and where it is located. Kidney is located at the back side on 2 sides of your spinal cord. Now let's discuss the role of kidney. The main role of kidneys are: first, blood purification; second, throwing away waste through urinal; bringing blood pressure to normal; regulation of pH balance. pH is the acid and alkali balance. It does electron balance. It removes waste and extra fluid from your body. Production of hormones. It removes acids from the cells to maintain the acid-alkali balance. It maintains the healthy balance of water, salt and minerals such as sodium, calcium, phosphorus and potassium. And the last is production of hormones. 95% people are given 2 kidneys, but one can safely live a life with 1 kidney also. Kidney also stimulate to produce red blood cells. The biggest role of kidney is to remove waste products from the body and to purify blood. Now let's understand the major reasons for kidney failure are: first, out of control diabetes, and second, blood pressure. 45% kidney failures are due to diabetes and 30% kidney failures are due to blood pressure. And there are many small reasons like prostate infection, accidental damage to kidneys, etc. At the last stage of kidney damage, the patient has got only 2 choices: either go for frequent dialysis almost 2 to 3 times a week, or go for kidney transplantation. But the damage of kidney can be found only by the creatinine levels, which comes when you go for blood test. If the creatinine level is more than 1.2, one should take it as a sign and one should start the treatment. Come to us immediately. Even if the kidney is above 2, we can bring the creatinine level to 1.2 within a month. Now the major reasons for kidney failure apparently are diabetes and blood pressure, but if you see, diabetes and blood pressure are basically due to some psychological and emotional reasons only. So we can conclude that more than 80% reasons for kidney failures are psychological and emotional reasons, and 20% are physical, that is accidental death or prostate infections. More than 80% people who have got diabetes have anxiety, and the same goes with blood pressure. People who are restless, in anxiety, in stress and tension, their acid level increases, their cholesterol level increases, and sometimes they face kidney failure also. Dialysis means the blood is purified through a machine, and it takes minimum 2 to 3 hours to do this process. 2 to 3 times a week one has to go to dialysis center. And kidney transplantation is a very expensive proposal, and there are many restrictions from the government. The demand for kidney transplantation is very much, and a rough estimate can show you that when the demand is for 1 lakh kidney transplantation, only 4,000 are fortunate to get the kidney. Now let's talk the fact. In India, more than 70% of the population has got some kidney complications. Diabetes and the blood pressure are the major reasons for kidney complications. In India, more than 10 crore people suffer from diabetes. And out of these 10 crore people, 30% people, that is 3 crore people whose kidneys are damaged. Every year, 2.5 lakhs people are added for kidney damages. Every year, 2.5 lakh people register for dialysis. It is estimated that more than 25 lakhs people need dialysis, but hardly 20% people are privileged to get this dialysis. In the world, more than 25 lakhs people are alive due to either getting dialysis done or kidney transplantation. In India, there is a shortage of dialysis center. A rough estimate is for every 10 lakhs people, there is 0.4% dialysis center. That means for every 25 lakh people, there is one dialysis center. In Japan, for every 10 lakh people, there are more than 25 dialysis centers. In India, due to strict rules and regulations by the government, on an average, 5 to 7,000 people only get the privilege of getting kidney transplant. Whereas the demand for kidney transplantation is more than 1 lakh per annum. And only if you got some blood relative who is willing to give you his or her kidney, then also the procedure takes 3 to 6 months to get the sanction. This is a very chronic illness and a threatening illness all over the world. In United States also, more than 13% people are suffering from kidney damages. In the world also, less than 10% people get the privilege of getting kidney transplant, and the demand is very high for kidneys. Now let's discuss the signs and symptoms of kidney failure. The first and the foremost symptom is that urine reduces significantly, that urination is very less compared to the intake of water. Second indication is there is a swelling in the body, especially in the legs. There is a retention of water in the body due to the failure of kidney to remove waste. Thirdly, unexplained shortness of breath, excessive drowsiness or fatigue, persistent nausea, confusion, pain in the chest, seizures and fit attack, coma. And once again I say, the root cause is kidney failure is only psychological and emotional, more than 80%, and less than 20% reasons are physical or food intake. We help in controlling creatinine level and kidney damage. We got two options for people. One is you can come to our center for 10 days wellness holidays, wherein we teach you all the things which need to be done, and the treatment is almost 10 to 12 hours a day, and within 10 days we share you with the technology of how to be healthy and how to control your creatinine level. And the second option is when you are in dialysis, you cannot come to our center. In that case, you can join our online program where, sitting at home, we guide you through Zoom app as to what changes you need to do in your lifestyle so that the kidney damage does not aggravate and you have some recovery also. Our programs are basically to detox your mind and your body, and whereas so far all over the world the focus is only on the body detox and the mind part is totally neglected, and that's why people also who are in their dialysis don't live long. Maximum, once you are in dialysis, on an average you don't live more than 10 years, and 50 patients die within 5 years also. And even those who are privileged to get kidney transplant, they also, more than 50% die within 3 years. That shows that even if you are privileged and you got the kidney transplant, still you have to come to us if you want to live longer. Because unless the root cause are dealt with, if you remain the same, if your attitude remains the same, if your thought process remains the same, you cannot live long with these complications. This 10 days is a very balanced program wherein if you got any disease for which you have to take medicines for a long period, you should attend this program. And we are sure that even if you got diabetes, blood pressure, migraine, arthritis, or any disease which is called chronic illness, you can benefit by our 10 days holiday program. You can extend also up till 1 month also for a healthy life. Now there is a research document which says if you take any painkiller or antacid tablet, both are damaging to your kidney. And 80% people are so used to taking antacid or painkiller, and frequent use of antacid tablet and painkillers are very harmful for kidney. Painkiller tablets are basically paracetamol tablets, and there are more than 100 names like Combiflame, Anacin, Brufen, and there are many names, many brands. Thus, in any allopathic treatment, 2 tablets are always given for any illness which is chronic. One is antacid, and there are more than 100 brands, and the other is painkiller, and both are dangerous for the kidney. Now let's discuss what food to intake and what food to avoid in order to mitigate the kidney damage. So let's discuss what food you should take. Raw food are the best food for kidney. Second is watery products like fruits, fresh juices, hot water, hot food. And now let's discuss what food to avoid. Dairy and dairy products, bakery products, spicy products, cold drinks, alcohol, smoking. Also avoid vegetables with seeds like tomato and ladyfinger. Also, please note, avoid salt and sugar, because the job of salt is to retain water and the job of sugar is to create acid. Now we will discuss the 7 golden rules which can help you in mitigating your kidney damage. And even if the kidney is damaged, this will help you in at least living long. The first is compulsory exercise for 2 to 3 hours. Second, control your blood pressure and diabetes. Eat healthy food and balance your diet. Drink water at a regular interval but not in excess at one go. Avoid smoking and tobacco chewing. Reduce your stress level by enjoying your life by playing games. Make the patient laugh and let their mindset be positive. Drink lot of water, fluid. If the kidney is not damaged, if the kidney is damaged, your water consumption also will be regulated, and you have to take doctor's advice. Okay, once again I repeat, the root cause of kidney damage is 80% psychological, emotional, and 20% is only physical. So come to us. If the creatinine level is very high, come to us. Even if the kidney is damaged and you are advised dialysis, in that case you can join our online program, which is minimum 1 month program. Sitting at home, you can learn the new way of living life, understanding relationship, making your mind positive and enjoying life. We can help you at all stage, even if you are at the last stage, or even if you have got your kidney transplant done. Still, it is recommended you should join our 1 month program to increase your lifespan and to enjoy life. Thank you once again for watching this video. My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. We are situated in Mumbai, India. Thank you.